Unfortunately, I don't think physician burnout and exhaustion's been new. And, in 1998, we went into Intermountain Healthcare, their medical group, and talked about physician burden and what were the things that were the most burdensome to them. And it was the overwhelming issues that their families had. They didn't mind improving care for diabetes and asthma. They thought Brent James, well, a great guy, he's really smart. Yeah, we're going to do that. But what are you going to do to help us with all the domestic violence, substance use, depression, and anxiety our families are coming in with too? They have more than just the medical chronic conditions, and Intermountain took them serious. So we've spent the last 18 years really rebuilding the environment, like you were saying, of primary care to support patients and families, and then the providers and staff that work with them, because the staff was just as burnt out.
Yeah, it's everyone across the care continuum.
And what we learned as we moved through it is that everybody needed support. Patients and families needed support, physicians needed support, MAs needed support, leaders needed support, and so we built a team-based care process to normalize mental health as a routine part of medical care, so that whatever the issue is when you come in, it doesn't actually have to be a mental illness, but all the chronic conditions are the same. Substance use is a chronic condition, depression's a chronic condition, and then there's lots of activity that comes into primary care that's just everyday life's really hard. And to be able to, get that early and have a conversation. And when we did our ethnographic interviews with staff providing care and patients receiving care, when they were operating within our clinics, and this is Intermountain Medical Group, they got really good medical group, it's organized, they have good protocols, but when they didn't have the team organized, the process, the environment, like you're saying, organized around them, that everybody had a role and did their job, patients felt isolated, like their doctor just refilled their meds and said, see you next year, and doctors felt isolated. They felt like, if no one else is going to do this, I have to do it. I'm forced. I am forced.
Yes,
yeah. So now we go fast forward 10 years. Now we have more on their plate. We have more social complexity. We have opioid issues. We have suicide. They're just getting bigger. And the one things our physicians tell us now is, Brenda, stop telling me team-based care and MHI make my life easier. Yes, it's better for patients, and we're getting good outcomes, but it's more work for me. And why is it more work? They have to talk to more people. And
right.
So that's where the technology comes in. We have to connect them up to be able to talk and connect. And I tell you one more thing, because I read your brochure on burnout. When we measured the patient's impact in the clinics that had team-based care, they said, my physician spent more time with me. We didn't give them more time. We're fee-for-service. But because there was a group of people around doing their job, the physician was able to, for 2 minutes, look at me,
comparative advantage.
Look at me in the eye and go, that's important. I hear you. I can help you. I need more information. I have people here that are going to work with me for it.
Right. And I was really struck when you were talking about physicians tell you, don't give me more to do. I have enough to do. And especially with
people I can trust. Yes. Connect me with people that know what the heck they're doing.
And especially with EHRs, for a lot of people, those represent that increased regulatory burden. We're giving more and more things.